A very good afternoon to all present here. I'll be speaking about the prevention and investigation of post-procedure ophthalmic infections. Let us start by looking into the various sources from which infection can get transmitted during a procedure. So the sources are environment, instruments, medicines or washes, disinfectants, patients or healthcare workers. And the prevention of post-procedure ophthalmic infections, it essentially involves taking care of all these sources of transmission of infections. So for environment, it is important to maintain a good quality air in the procedure room, and HEPA filtered air which is the one which is recommended for all the procedures. Optimum temperature and humidity also needs to be maintained, and the surfaces should be disinfected as per the recommendations of infection control team. If these things are taken care of on a routine basis, fogging is not required. And for quality control of these three, we need to do the maintenance of filters. We should maintain log of surface disinfection. Checking of the quality of air can be done by using the settle plate method and also by taking culture of the surface swabs. All instruments and drapes which are being used in the procedure should be properly sterilized, and the quality control should be maintained by using chemical or biological indicators. Also, at the time of using, intactness of packaging or seal should be checked by the user, and in certain sterilization methods like autoclave, the date of sterilization should be checked. Also, the random articles can be opened and cultures of swabs can be taken. The medicines or washes, etc., they usually come as pre-packaged consumables. So the user should check the seal and date of expiry, and also it should be physically examined before use. And the manufacturers of the instructions of the manufacturers should be followed for usage, dilution and storage, and random batches can be opened and cultured to look for any possible contamination. All the in-house preparations, if used, they should be checked batch to batch wise before releasing them for patient care. The scrubs and disinfectants, they also come as packaged consumables. So all the three things, checking the seal and date of expiry, physical examination and following manufacturer's instructions, they stand for them as well. Also, the components and the percentages of different components of disinfectants should be checked before releasing them for patient care. In patient, the comorbid conditions and the medications, etc., should be properly looked for, and adequate control of the comorbidities as well as stoppage of medications, if indicated, should be done. The infections in the vicinity should be treated before doing the procedure, and part preparation should be done adequately as per the standard procedure. The healthcare workers need to maintain a proper procedure room etiquette. Hand hygiene, following all the steps of hand hygiene should be done by all as frequently as required, and the standard procedures should be done at all times. Despite all these things, if a post-procedure infection does occur, then how do we investigate it? In the first place, why do we need to investigate a post-procedure infection? We need to do it to find out the possible source of infection so that we can control the source and stop the occurrence of further cases. And also during the investigation, we can find a lot of other errors which can be timely rectified for the infection control in future. So the first thing which we need to do in case of any post-procedure infection is to review all the reports of infection prevention in the concerned period. For environment, all the reports of air quality and surface disinfection need to be relooked at. For instruments, the indicators and the cultures of swabs. Also, the lot numbers and expiry dates of the medicines and the culture reports. For patients, we should relook into any missed underlying comorbidity, and whether it was properly controlled or not. We need to do some fresh investigations also, including repeat cultures of medicines and washes from the batch which were used in the procedure. For disinfectants, we need to look for the contamination, also for the effectiveness of the disinfection. And the samples from the infected site of the patients also need to be microbiologically examined for identifying the pathogen and managing the case. So whatever errors are identified, they need to be rectified and control steps have to be taken. For example, in one of our investigations, we found that the batches of povidone iodine and scrub, they were ineffective on the skin surface disinfection. So these batches were called off from all the patient care areas, and the patient who underwent procedure with the disinfections using above lot were recalled and inquired about possible symptoms of infection so that they could be properly managed in timely manner. At our center, all the procedure related infections need to be notified to the Infection Surveillance and Monitoring Committee, and a documentation of the occurrence of infection, all the investigations, follow-up, control steps, etc. is done and filed. So these are the forms which we fill as a part of the post-procedure infection investigation. This is the Form A, in which the presenting features of the patient with infection as well as the details of the procedure, etc. are there. And this is the Form B, in which the daily follow-up of the patient's condition, improvement, medications given, any reports which are coming in, all those things are maintained on a daily basis. So I acknowledge the efforts of ocular microbiology team and infection control team in management, prevention and control of all the post-procedure infections in our center. Thank you for your kind attention.